My name is Cary Smith. I'm the senator from Senate District 27. I live in Billings, Montana. As I was thinking of things that I could make an impact on, I realized that as we were coming into a period of time with Obama, and we had Obamacare coming up, and we'd had problems in health care for years on it being too expensive, I wanted to try to address the health care issue. Well, I've worked with FGA on a couple of bills. I've worked on the right to shop bill, and I've also worked on a welfare reform bill.
My name is Josh Areshula. I'm a senior fellow at the Foundation for Government Accountability. I think Senator Smith impressed me most with his tenacity, believing in the cause, and making sure that he left no rock unturned to try to get right to shop passed in Montana.
Well, what right to shop does, and what it adds to the law that we already have on the books in Montana, is that it requires that the insurance companies provide you with a tool so that you can take and find out what the expenses would be for a procedure for different hospitals, different medical providers. And then if you find a place that you want to go to, or a physician or hospital that gives a lower price, then you have the right to do that. You have the right to shop, and then you share with the insurance company on any savings that you make by shopping for a lower health care provider.
FGA worked really closely with Senator Smith whenever a hurdle came up, trying to offer any assistance, whether it be a simple phone call to talk about objections, talk to state agencies about any questions they had about implementation.
What I like about working with FGA is carrying legislation can be so frustrating that if you're out there trying to do it on your own, you're a lonely person on an island. And so that support that comes through there helps you to take and get ready for each battle that you have and start the fight over again and continue to working on it. Some of the assistance that FGA has come up with is providing research and data for me that I would never be able to do as a Montana legislator. We're a part-time citizen legislature. I have no secretary, I have no aide.
To Senator Smith's credit, he did most of this on his own. He went out and found like-minded individuals that understood that healthcare is unsustainable, and he had a number of them show up to the Capitol and testify in support. It lent a lot of credibility to the bill moving forward.
I would say that one of the greatest successes we had was we were really able to bring together bipartisan support. I'm considered to be one of the most conservative members of the legislature. I was able to get a young woman to co-sponsor the bill that would be considered one of the most liberal. This should not be a Democrat or Republican issue. This should be an issue where we take care of the people. I think people's rights are important.